Hello, welcome to day number 7, health-related issues. I'll be giving my answers as examples in the questionnaires. The author starts with a quote: "The issues you resolve before will become blessings of harmony and love after the wedding." Before you get together for your date, spend 1 hour individually filling out the health-related questionnaires. This day will take 2 hours. Afterwards, at home alone, record in your journal, which I have at the end of the link in the description, and journal your reactions to the evening with your partner. Are there any health issues too overwhelming for you to handle? Do you need to seek professional counseling over these issues? Ponder and monitor your heart. The Spirit within each of us will speak to you through your heart and mind. Instructions. On the date, discuss your answers on the questionnaires. If you have serious health issues, will they cause problems for your future marriage? Can you figure out a strategy for dealing with these issues on your date? Be candid with each other. Try to make the date relevant to the subject to be discussed. Use your imagination. Here's one suggestion. Take your partner to a hospital waiting room. Usually lobbies have plenty of seats for you to be able to find a comfortable spot to compare and discuss your answers. Halfway through the date, take a break to visit the obstetrics floor. Take a look at all of the newborn babies. Notice your partner's feelings. Does he or she look forward to such an event in the future? How does your partner react to the hospital setting? Questionnaire number 1. Health-related issues. How were you treated as a child when you were sick? I stayed home and played games. Did your parents believe in going to the doctor, or did they prefer home treatment? Did they prefer traditional or alternative medical approaches? Preferred going to the doctor and using medicine? How do you feel about you or your partner taking over-the-counter drugs such as antihistamines, sleeping pills, medicine? Those are fine if you want to use over-the-counter drugs. It's fine with me. How do you feel about taking vitamins and other supplements? Vitamins are fine if you want to use them. How much do you think psychological issues affect illness? It's rarely or minimal effect on illness. It's just my 2 cents. How do you want to be treated or cared by your future spouse when you are ill? How about a cold or the flu or other illnesses? How about during pregnancy? When I'm sick, no kisses on the lips. How important is health insurance? Do you have insurance now? How do you want to handle this after you are married? $2,000. Just don't die. You don't have to worry about it. List any chronic illnesses you have, such as asthma, bad back, diabetes, herpes, rheumatoid arthritis, etc. Have you told your partner? If not, why? What kind of help do you need when your condition flares up? List your health history, childhood diseases, bones, fractures, operations, etc. I've been diagnosed with schizophrenia unspecified, even though I don't hear voices or see things. So that's my health history. List any health issues that are prevalent in your family, such as ADHD, dyslexia, Down syndrome, cancer, heart disease, diabetes, etc. Do you have concerns about these illnesses? When you are together, discuss and decide what you are going to do to resolve these concerns. For the women, do you suffer with PMS or other menstruation-related problems? Have you talked about it with your partner? For the man, if your partner suffers from female health issues, do you know much about the subject? I don't. Would you be willing to read books to understand the condition and learn what you can do to give her the kind of support she will need during these times? I'd be willing to read about it. Do you have a history of mental illnesses in your family? No. Have you been treated for depression? I'm not depressed. Have you experienced any mood disorders? No. Do you currently have any sexual diseases? What are they? No sexual diseases. Have you had any sexual diseases in the past? What was your treatment? What is the current prognosis? When you're together, discuss. Do you agree with your partner about medical issues, or are you in conflict with each other? If conflict exists, how can you compromise? What rules will you set to respect each other's views and systems? Discuss and resolve any health issue and approaches now. Decide to treat each other's ideas and approaches with respect. Questionnaire number 1 continues. Sleep issues. How many nights a night do you need to sleep? I need 8. 8 hours. Are you a morning person or a night person? How will you resolve related conflicts or if they arise? I can be either a night or morning person. I just need to stick to a schedule. Pregnancy issues. Do you expect your partner to take LeMays or brother breathing classes with you? Do you believe in natural childbirth only? For the man, would you be disappointed if your wife used medical help during the birthing process to numb the pain? I don't believe in only natural childbirth. C-sections are fine. I don't care if she uses medical help to ease the pain either. For the man, do you expect your future wife to stay at home with the child, even though through the childbearing years, or return to work in a reasonable time after childbirth? What is a reasonable time to you? I don't mind helping out with taking care of the child, or we can get a babysitter. For the women, do you expect your husband to take leave from work to help with the baby? Do you believe in nursing a baby? For how long? Is nursing in public acceptable? We nursed the baby for about a year. Nursing in public is okay with a poncho. If you weren't able to have children, would you consider adoption? How do you feel about fertility treatments? How do you feel about artificial insemination? With husband sperm? With donor sperm? I'd rather not use artificial insemination. Grooming. Is it important to you that your partner bathes every day? At least once a week. It's not important for my spouse to bathe daily, but I do. Have you noticed any hygiene issues with your partner? What are they? Do you brush your teeth and floss twice a day? Is it important do you have 6-month dental cleanings? I brush my teeth twice and floss once a day. And I don't think it's important to have 6-month dental cleanings, but I have some anyway. Is it important to you that your partner uses mouthwash or other breath fresheners? I don't mind if they don't. Is it important to you to have professional services such as manicures, haircuts, styling, massages, etc.? How often? Once a week? Once a month? I get a haircut once every 10 weeks, approximately. Do you insist on professionally laundered clothing, shirts, blouses, etc.? No, my clothes don't need to be professionally cleaned. Is it important? Do you insist on professionally? Okay, another one. How important is it to you to keep your body in shape by participating in regular sports, attending a health club on a daily basis, or exercising on equipment at home? I exercise 3 hours a day, except for Sundays and some holidays. How important is it for you to have your spouse stay fit, trim and fit? Very. Proverbs 24:5 says, "A wise man is strong; yea, a wise man increaseth strength." Will you support your mate if he or she wants braces? How about for your children? Do you believe? I don't mind if they get braces. Do you believe in coloring your hair or going gray? I would go gray. Do you believe in cosmetics or are you all natural? I don't believe in cosmetics, so I guess no makeup or lipstick is fine. How much time do you need to groom each morning? How much of this time will be in the bathroom? I need 30 minutes, including my shower. How do you feel about aging and cosmetic surgery? We don't need cosmetic surgery. Do you see yourself as a high maintenance or low maintenance person? Do you foresee conflicts with each other? If so, what are they? Can you resolve them? I'm a low maintenance person. Drugs, alcohol, and other addictions. Do you have a history of drug or alcohol abuse in your family? If so, describe the abuse and how it affected you. No drug abuse in my immediate family. One of my stepbrothers had died due to a drinking problem, though. Are there any unresolved issues about drug or alcohol abuse in your family? If so, describe them in detail and how you will handle them in the future. Have you had treatment for alcohol addiction? How long? How long ago? What is your status now? I've never had alcohol. Do you take drugs? No, or only prescription. Have you ever taken drugs? What kind? How long ago? I've never taken drugs. Have you ever been in rehab for drug abuse? Are you clean now? For how long? If you ever have been addicted to drugs or alcohol, what are you currently doing for your addictions? Are you currently addicted to cigarettes? If so, how many packs a day do you use? I'm not addicted to cigarettes. I hope my spouse isn't either. If you smoke, do you want to quit? Does your partner object to your smoking? I object to my partner smoking. Do you use marijuana? If so, how often? Do you use any other mind-altering substances? If so, what? If you have a problem with substance abuse, what are you going to do about it? What are your current views on the use of alcohol or drugs? Say no to drugs. Don't drink alcohol. There's a scripture that I like in Proverbs 31:4-7 that talks about drinking and avoiding it. Do you view pornography? Do you attend strip bars? If so, have you told your partner? What are you going to do about it? No pornography allowed, not to mention strip clubs. Concepts to consider. Without good physical health habits and the support of your mate to maintain a good health, it is hard to have a healthy and loving relationship. Carefully resolve your differences prior to the marriage. Seek counsel and or medical help for any unresolved health issues such as drug abuse, sexual diseases, and other addictions and illnesses prior to the marriage. Delay your wedding until you have resolved these issues. You will be grateful to yourself that you used wisdom. Cassie's mother was a nurse. She had grown up with a mother who nursed her back to health when she was ill. Many times her mother forced her to stay home from school to get well. Cassie was ambitious, thrived on schoolwork, and excelled in extracurricular activities after school. Cassie would never stay home unless she was practically on her deathbed. When she married Andrew, she had no idea that he thought most illnesses were psychological. He had a very healthy person naturally, and no understanding when she became ill. He would tell her that it was all in her head. As the years went by, this was a great source of contention between them. One day Cassie went to the hospital in an emergency situation. She was doubled over in pain. The doctors on call identified her pain as a ruptured appendix. They operated immediately to save her life. Her dogmatic husband refused to believe that the operation was necessary, and he refused to talk about it. They didn't have any children, so Cassie filed for divorce. Any love that she once had for Andrew was eroded away by his intolerance. If you cannot resolve these issues prior to the wedding, it's okay to call it off. It may be painful for a while, but later, when you find Mr. or Miss Right, you will thank yourself many times over for your strength and wisdom to make the right decision regarding your future. Don't forget to journal, and please like and subscribe. Is there anything new you learned on this day? Did you have any unresolved differences or conflicts? What do you plan for resolution?